This is part two of my series on the C's of cancer. Today, the C that I want to focus on is connections. Connections. I was on an airplane a few months ago and I was writing in a new journal that I purchased because I thought I'll start journaling and keep a diary and my thoughts and reflections of this journey. And I was frantically trying to record everything I could think of, everything I'd been through, my impressions based on my life experience. And so I jotted down 10 concepts, which I'll share with you in just a moment. And the lady next to me on the plane said, "What are you writing?" And I said, "Well, I have cancer, and so I'm just trying to capture what this has meant to me, what I've learned very broadly." So that's what this part two is about. It's about connection. So here, straight from my diary, are the 10 connections that I've made, sort of as a scholar while I've gone through this. Number one, and they're not in any order. Number one, I've become very aware, deliberately, of different health practices and choices across cultures. That means I don't think that the United States is the only country in which persons experience cancer. So I've tried to look globally to learn about all the kinds of practices, therapies, treatments that persons are doing around the globe. And since I worked with a non-GO, non-governmental organization within the United Nations, I have access to members of our organization, which was called ISAC, the International Society for Augmentative and Alternative Communication. And that's let me have access to friends and colleagues around the world to learn about cancer. So that's number one. And I'll speak a little more about some of these as time allows. Number two, I've become keenly aware of the impact that various belief systems and spirituality have on our health. Now, when I was a professional, I got a federal grant, and I emphasized through focus groups working with persons, families whose members of the family had disabilities, different conditions, and so I was able to look at why members of various communities select or seek health services or not. And so it impressed upon me as I've gone through this that belief systems and spirituality is linked directly to our cultural backgrounds. Also, it became very clear that there are age issues. I'm older. My physicians and surgeons were about my age, and so it was interesting to work within the context of age when they were probably trained when I was trained, and therefore what I expected from them as my doctor or as my therapist. Another was gender differences. My surgeries were taking place during the Me Too movement, and because I'm a female and my physicians were all male initially, the gender differences in engaging in a dialogue as a patient with a doctor who's a male, me being a female, became very apparent. And of course, I couldn't say anything because I was the patient. Well, I could have, but I didn't dare because I was seeking their services. I didn't want to antagonize them or make them feel uncomfortable or appear too assertive. But the gender differences certainly were there as I saw it and dealt with different treatment practices and choices and challenges. Toward that, it was very evident to me about the powerlessness. Again, I was a patient, I wasn't the professional, and so when I met with various professionals across various treatment areas, I felt that powerlessness as a patient within that medical system. I also noted that there are very narrow viewpoints to treatment practices, and there are very wide viewpoints by some professionals as you make inquiries. So that was interesting. Further, the Western and Eastern health care are governed by our professional licenses, our training, education, and finally I most recently had the opportunity, as you might have remembered on some of my earlier videos, to really experience Eastern medicine for the first time, or energy medicine, some might refer to that as. In other words, I've participated in acupuncture, I participated in cupping, pressure point releases, and so I've learned more and more about the energy medicines and the practices in Eastern medicine that are 5,000-6,000 years old, and I've really enjoyed adding that to my toolbox of Western medical practices, if you will. It also became very apparent to me the semi-professional practices that some members evidence when you seek out their care, laypersons, the elitism that are in some especially affiliated with the university medical practices, academia, almost snobbery when you mention other what some persons call woo-woo sciences. And the woo-woo sciences I found to be extremely helpful to me. But that elitism, almost snobbery between so-called educated persons and lay persons became very apparent as I've gone through this 3-year journey. I've always been described by my family, my son, as a woman of the people. I practiced my whole career providing human rights and advocacy for persons with the most severe complex communication needs and intellectual disabilities and the most severe physical challenges. So to go through this, really having support for persons that are disenfranchised, and then looking at myself all of a sudden in that context, culturally, socially, economically, it's been quite a journey. And then the 10th point that I jotted in my diary that day was mainstream pharmaceuticals versus all the medieval ancient remedies, the homeopaths, the integrative therapies, the alternative practices, homemade remedies, herbs, spices that are practiced, especially in the East, like in Singapore, Thailand, Hong Kong, Philippines, and so forth. It's just been amazing to make these connections, which is what this part of this video is about, the connections through cancer. And so those are the 10 experiences that someday I want to write more about, talk more about, that I've personally witnessed and experienced as I've gone through this cancer journey. So in conclusion, I would simply ask, what have been your connections? Blessings to you.